So step 2 is the E, extract the appropriate procedure or service code. Once you review the medical record, you move on to step 2, which is extract the procedure or service code. And you have to go back to the documentation, which is step 1, and that's where you find the information. Step 2 involves the CPT or HICS codes. So we're going to go into some detail in the next few slides about what those codes actually are. CPT on slide 11 explains that CPT converts medical procedures and services into 5-digit alphanumeric codes. These codes actually describe whatever service or procedure your provider performs. There are 6 sections to the CPT codes in the main section of the CPT manual. They're listed there in the third bullet. I'm going to go into a little bit more detail that's not actually on the slide. Evaluation of management, or EM codes, is the first section. These codes cover the non-procedural services your practitioner performs in the office, outpatient facility, inpatient facility, or nursing facility. These codes in the EM section are based on 3 key components: the history, examination, and medical decision-making. The second section is the anesthesia services section. The codes you'll find in here relate to any type of anesthesia, including local, regional, and general anesthesia. The third section is the surgery section, which contains any codes used to report major and minor operative procedures. The section is basically divided by organ systems and then also by anatomical position, going from the top to the bottom of the body, so basically from the head to the toe. The fourth section contains the radiology procedures and service codes, which is fairly self-explanatory. Obviously, there's radiology procedures in there. This section is the pathology and laboratory section. This is where you'll find codes for laboratory services that are performed on bodily tissues and fluids for basic pathological analysis. And then the final section of CPT codes is the medicine section. And this section contains codes for miscellaneous procedures, specialty services, such as immunizations, chemotherapy, infusion therapy, injections, psychiatry, cardiovascular, rehabilitative services, and more. The CPT codes are maintained by the American Medical Association and are updated every January 1st with occasional smaller updates throughout the rest of the year. But the big updates are done January 1st of every year. I did want to mention there are 2 supplemental sections in CPT, the Category 2 and Category 3 codes. Category 2 codes are used for tracking performance measurements, and then Category 3 codes are the introduction of temporary codes that don't have a quote-unquote regular CPT code yet, which would be found in the beginning Category 1 section of the CPT codes. The Category 3 codes are usually for emerging services or procedures. A lot of them use newer technology, and they're trying to evaluate whether that technology is actually going to take off and needs to have a permanent code. There are also several appendices in the CPT manual, which include a lot of information that we really don't have time to go into today, but that's all important to coding. So at some point when you have a chance, you should really review all of the CPT appendices as well as the main code sections. For example, Appendix A of the CPT manual contains a list of modifiers that you could potentially need to apply to your claim. Modifiers indicate a service or procedure was altered in some way, but the main code descriptor that you're reporting is not actually changed. So you'll use those modifiers to provide payers with additional information, help explain clinical situations, break code bundles, capture extra payment that you might deserve, and more. So you'll see why these appendices, especially the Appendix A, which is the modifiers, are really important coding information that you're going to need to know. As I mentioned, the next set of codes that you might use to report a service or procedure are the HICS codes. You choose a code to represent the procedure or service or supplies or drugs. HICS codes cover a whole range of different things. It's a nationally standardized set of codes that we use to identify services, procedures, and supplies, and they're alphanumeric codes, which means they start with a letter and they end with 4 numbers. And I wanted to just kind of run through a couple of examples. There are many, many codes in the HICS manual, which you want to review. But some of the ones that you might use often are the A codes, which represent medical and surgical supplies. You'll find those in the A code section, which means that the codes start with an A and then have 4 numbers after. You may also use E codes, which are for durable medical equipment, or DME. G codes represent temporary services or procedures, and J codes you'll use to report drugs. So those are just a few of the HICS codes you might run into when you're reporting a claim. There are many other types, but make sure if you're going to use HICS codes, if you think you're going to need them in your specialty, you will need to review all of them. There's also HICS modifiers that work like the CPT modifiers that I mentioned earlier and add additional information to your claim. Some of these are carrier dependent or payer dependent, so whether you actually need them or not will depend on who you're reporting and sending your claim to. For example, if you're coding a procedure involving the fingers, you may need to use the F1, F2, F3, F4, F5, F6, F7, F8, and F9 modifiers on your claim to tell the payer exactly which finger your provider performed a service on. But again, as I mentioned, these are payer specific, so it's going to depend really on who you're reporting these procedures to, whether you need certain HICS codes and the modifiers as well. Just like with CPT, the HICS codes are updated every January with smaller updates made throughout the year. You'll see that on this slide 12 here with the HICS codes, I have my second golden rule of coding. Now this golden rule does not apply just to HICS codes. It applies to all codes, the CPT, ICD9, and HICS. But I stuck it in here. And that golden rule is stay up to date on code changes. This means any additions, deletions, or changes. As I mentioned, CPT and HICS are updated every January 1st, but there may be smaller updates throughout the year, and you always want to make sure that you know what those updates are. I think one of the most important keys to whether you actually as a coder submit the right codes is whether you're using current up-to-date materials. So make sure you get new manuals every year, or even better, subscribe to a service like supercoder.com so you always have the most recent information and the most recent codes. If you're using old codes, your claim is going to be denied because those codes obviously are not still in existence. If you are using coding for something that has been added, you may have a code now that you didn't have before that you now can use to accurately report the service your provider is providing. So make sure that you stay up to date on all of the code changes. On slide 13, we're going to move to step 3, which is the A, assign a diagnosis code. You need to scour the documentation. Again, we always go back to step 1, which is look at the medical record. You'll scan the documentation and discern the reason for the procedure or service. Basically, you're going to choose a code or codes, you can have more than one diagnosis code, that explains the reason for and justifies the medical necessity of the procedure or service your physician performed. Every procedure must have a diagnosis code associated with it. For these, you'll turn to the ICD9 codes, which we're going to talk about on slide 14. ICD9 uses numeric or alphanumeric codes of 3, 4, or 5 digits to classify symptoms, injuries, illnesses, and diseases. There are actually 3 volumes in the ICD9 manual. Volume 1 is the tabular section, which you'll use primarily for physician billing. And then this tabular list actually classifies the groups of diseases or injuries according to etiology and also by various organ systems.